Hello and welcome to everyone joining us on the Liverpool Echo Facebook page. I am political editor Liam Thorpe and I'm pleased to be joined today by Matt Ashton, who is the Public Health Director for Liverpool. Thanks for coming on, Matt.
Welcome.
We're here
Afternoon.
to talk about an important subject that I know a lot of people will be quite concerned about, which is about the rise in cases of Group A streptococcal infection, commonly known as Strep A. We know that there has been a rise in these cases, mainly in children around the country. There have been a small number of deaths, which is very sad to say. And we've been affected here on Merseyside as well. We know there's at least a case here, and there's obviously a very poorly little girl in Alder Hey at the moment. So we thought it was really important to speak to Matt and other health professionals as well, because it's a concerning time, particularly for parents, and we just want to get some important information and guidance out there to people, the people of Merseyside. So during this discussion, if you have any questions yourself on our Facebook page, if you leave them in the comments, and they will be put through to our studio, and we can put them directly to Matt, who is the Public Health Director. So Matt, if we could just kind of start with it for those who aren't too aware of Strep A. I know there is a couple of different versions. There's some confusion around its relationship to scarlet fever and other illnesses. Could you just give us a basic background of what Strep A is and the different forms it can be?
Yeah, sure. So completely, the terminology can be confusing here. So from very simply, Strep A is just a bacteria. It's a common bacteria. It exists on most of us. It can be on our skin, in our nose, in our throat. And we're surrounded by it as we are other bacteria. Sometimes Strep A can go on to cause diseases. And one of the things it can cause is scarlet fever. There are other things, for example, you might have heard of also of strep throat. So, and scarlet fever is a very common childhood illness. We've had it forever. It seems to be a bit cyclical in nature. So every 4 years or so, we get a spike, a peak in cases. It's a very common childhood disease. It's mild, but it's very infectious, and therefore there are things we need to do just to make sure we try and control the spread of scarlet fever. One of the other things that Strep A can do is cause serious illness. And that is it's when it causes invasive infections in our body. It's sometimes called eye gas, and that can be serious infections of our lungs, so a lung infection, or of our bloodstream. And that's when people tend to get seriously ill and need hospital treatment. Most of the time, with things like scarlet fever, you don't need hospital treatment. You need a course of antibiotics, you need fluid, perhaps paracetamol, and in a couple of days, 24 or 48 hours, you'll be fine and back on your feet again.
As you can imagine, there will be a lot of concerned parents, and it's a difficult time of year anyway for infections, for a rise in flu. We've still got COVID knocking around. So we've got a few questions already coming in, people asking about kind of symptoms to look out for. Catherine Locke says is a chesty cough common with Strep A. What are the key things that parents should be looking out for, and what is your guidance for what they should do if they experience these symptoms in their kids?
Okay, so just to start with, um, we all get ill all the way through the year, don't we? But winter is a particular time of the year where there's lots of things flying around, lots of viruses, lots of bacteria, and people, do get ill. Kids often get ill this time of year as well. And sometimes we just get ill with mild stuff. So, coughs, sneezes, if you like, cold and flu type illnesses. Scarlet fever is different to that. So, scarlet fever symptoms tend to be fever, as in the name, headache, a sore throat, but the rash, the sandpapery red rash on your body that highlights it as being something different from the usual stuff that people perhaps get at this time of year.
If parents are witnessing any of these symptoms, from the kind of more like the kind of cold and flu symptoms to, as you say, the more specific sandpaper rash symptoms, where should they be directed to first? We know we've spoken to people at Alder Hey. There's obviously quite a lot of people turning up directly there. Would you suggest they went first? People went first to primary care, to their GP, or any other avenues?
Yeah. So as I said, scarlet fever is a mild infection, but it's very infectious. It's very easy to pass on. So firstly, you shouldn't be in school or work if you're suspected of having scarlet fever. Secondly, you or the child's parents should be phoning 111 or speaking to their GP with a view to describing the symptoms, describing the illness, and if it's scarlet fever, hopefully getting antibiotics prescribed. And then thirdly, scarlet fever is mostly managed at home. So that's wrapping up warm, drinking plenty of fluids, making sure you eat something that's easy on the throat. So perhaps soup, and managing any fever through the use of paracetamol. As I say, usually mild, self-limiting, highly infectious, just managed at home.
Is it worth putting some kind of context into the news we've been hearing? It's obviously concerning and really tragic to hear that a number of deaths have been associated with this rising cases. Is there any kind of reporting going on about what is perhaps causing a rise in cases, and how does that kind of compare with previous years? And is there any kind of reasoning behind that, possibly to do with COVID or the lockdowns?
So just need to separate out scarlet fever from IGAS. We
Yeah.
are seeing increases in both. Scarlet fever, um, probably 5 or 6 times the levels we've seen in the last couple of years. But as I said at the start, scarlet fever does seem to be cyclical. So every 4 or 5 years or so, we do see that spike or that peak in numbers. Reasons behind that doesn't appear to be anything new. Scarlet fever is a old and very well known and well understood disease. It's just likely a cyclical disease and is spread more by people mixing in close proximity. I think the other thing is that because numbers have been low for the last couple of years, you've got a cohort of people, kids under 10, who haven't had scarlet fever, and therefore, if they do catch it, they haven't got the resistance to it, so it will be a new infection for them. So, as I say, not new, but probably cyclical in nature. If we come back to and it's mild, so you're not going to get seriously ill. You would not normally get seriously ill as a result of scarlet fever. If you
Just
go
on
on
that, Matt,
to
is it just because we've had a question? I think you have answered that from Ronnie Owens, saying in terms of scarlet fever, should children stay away from school to prevent it spreading? I think you said yes to
yeah,
that with a course of antibiotics.
yes, with a course of antibiotics, but normally 24 hours after starting those antibiotics, people are safe to go back to school or to go back to work. It's very simply managed. Just get the antibiotics started.
And you suggested as well, and just referring to a question from Natalie Jones, that she said both her children have temperatures of 38.77 and have headaches, leg aches, no cough or sore throat. They've She said they've both had scarlet fever years ago. Can you still get it again?
I think it would be unusual to get it again, but I think this is where you get into individual medical advice,
Yeah,
and that's where phoning 111 or going to see the GP would be the
absolutely.
best appropriate advice.
Um, in terms of Liverpool and Merseyside, I don't know if there's anything you can tell us about what the rates are like at the moment, or is it something that we are suffering with more than other areas, or is it kind of the rise is in line with everywhere?
Yeah, yeah. Our numbers, the data that we've got shows that our numbers are in line with the pattern that's being seen at everywhere in the UK. So, as I say, 5 or 6 times what we've seen over the last couple of years, but no different from elsewhere in the country.
Obviously, we know that the NHS from primary care to A&E to everywhere is under a great deal of pressure. There are probably going to be people ringing their GPs and struggling to get through. Is it about being a bit persistent with that, keeping, if you don't get through straight away, try again, particularly if the symptoms aren't particularly serious?
Yeah, exactly. So if this is suspected scarlet fever, so if this is a fever, headache, sore throat, and a rash in your body that feels like sandpaper, that is 111 or your GP. And if you can't get through because the system is very busy, people are working really hard, but there's a lot of infections, a lot of viruses doing the round at the moment. So just keep trying. It's different if your child or you are seriously ill, and it's really important to make that distinction between something that's mild but uncomfortable but mild, and something where somebody is seriously ill. And so, as you mentioned at the start, Liam, we have seen a small number of deaths across the country as a result of eye gas in that invasive Strep A infection, and that is obviously tragic and really sad for everybody involved. If your child or you are seriously unwell, then that is when A&E comes into it. That's where you phone 999 or you get yourself to ambulance, and that's normally around if, for example, your child is having difficulty breathing, if they're making grunting noises or their tummy's really sucking up under their ribs as they're trying to catch their breath, or if the skin, the tongue, the lips are blue, or if the child is floppy, will not wake up or will not stay awake,
Yeah.
then that's when there's something wrong, and that's when it's 999 and or A&E.
Yeah. Just another question. I think we have answered this, but thanks for writing in. Neil Anthony asks, should we keep our children off school to protect them? Matt answered before that with those symptoms, if they are on antibiotics, you should keep them off school, but for it should be hopefully sorted with antibiotics in 24 hours or so.
Yeah, a short period of time. So
Yeah.
if people haven't had antibiotics, absolutely shouldn't be in school. Very infectious, but with a course of antibiotics, you can very quickly get back into school or into work.
And just on that infection prevention, as well as keeping kids off school, is there anything else people can be doing within their own families to try and prevent the spread?
So there's a couple of things, and we do always talk about good infection control, especially at this time of year. It's the simple things we can all do to try and minimize the risk of infection, be it Strep A, scarlet fever, anything else. So that is really good hand hygiene, washing hands, particularly after going to the toilet and before and after eating. It's also sanitizing surfaces. So whether that's in work or at home, keeping surfaces nice and clean. If if we're coughing and sneezing, then keeping our distance from people, especially our vulnerable adults, vulnerable friends, and cough and sneeze into the crook of our elbow or into a tissue, just to minimize the risk of spreading that infection. The other thing I would say is flu immunization is really important. So if you haven't had a chance to have your flu vaccine, do go and get your vaccine. Where infections tend to be worse is when your body is fighting several things at the same time. So if you've got scarlet fever plus chickenpox plus flu, all kind of circulating in the same space, that's when people, particularly if have got other underlying health conditions, people can get seriously ill. So the more we can do just to keep people safe, the better, and that includes making sure we're up to date with our regular vaccinations, including the flu jab.
Brilliant. I think we've had plenty of questions coming in. I guess one final thing I'll just ask from you, Matt, really, is that there's obviously going to be a lot of concern. People worried about their children, worried about the news they're seeing. Is it worth, just offering a bit more, offering a bit of reassurance that this is not completely out of the normal, what's going on here in terms of the rising cases?
Yeah, absolutely. So this isn't out of the ordinary. We do see scarlet fever. We see scarlet fever all the time and every year. And then every couple of years, we see peaks in it. So it isn't out of the ordinary, especially perhaps this year when we knew we were going to have a difficult winter and there's lots of pressure in the system. And you've got kids that perhaps haven't had scarlet fever over the last couple of years. We're seeing a peak in numbers. Mostly scarlet fever is mild and entirely manageable, especially with a course of antibiotics. But if your child is seriously ill, through the things that I've mentioned, including difficulty breathing, difficulty staying awake or sitting up, or indeed, parts of their body turning blue, then obviously that's when we need to take this stuff seriously. That's when we need to be phoning 999 or going to A&E just to make sure everybody is okay. But mostly scarlet fever is all right, and it's absolutely in line with what we'd expect to see, although at a slightly higher rate than the last couple of years.
Great. Well, thank you very much, everyone who's tuned in and everyone who's messaged in, and most importantly, thank you very much, Matt, because you've offered some crucial guidance and some good reassurance there. And if you have been unable to join us, you can watch this back on the Liverpool Echo Facebook page, and we'll be writing up Matt's guidance as well. So thanks very much for joining us, Matt, and thanks everyone for tuning in.
Thank you.